So good morning to all of you. Good morning. Nirav, good morning. So just wait for 1 minute more so that others also join in. Okay, so we'll start. We'll start with the MCQs. Have a look, understand this, think and answer. Starting with the first MCQ, continuing with the series of high yield MCQs, especially for the FMG students. Okay, I'm Dr. Pradeep Pawar, Professor of Anatomy, having a vast experience of teaching anatomy. So we'll start. Which of the following is derived from umbilical artery? Which of the following is derived from umbilical artery? You can answer this. You can guess, you can answer. That's fine. Even if it is wrong, it's okay. You answer. Yes, very good. Very good. That's a medial umbilical ligament. Medial umbilical ligament. Very good. So this is the obliterated part of umbilical artery. The obliterated part of umbilical artery forms the medial umbilical ligament. And if you can tell me the non-obliterated part of umbilical artery is going to form what? Anyone? The non-obliterated part of umbilical artery forms. If you can answer this, it's okay. Otherwise, I'll explain this circulation to you. The non-obliterated part of umbilical artery. Obliterated part se banta है medial umbilical ligament, and the non-obliterated part is going to form the superior vesical artery. Yes, superior vesical artery. Fine. Ligamentum arteriosum is derived from what? It is derived from ductus arteriosus. It is derived from ductus arteriosus. Ligamentum venosum is derived from ductus venosus. Ductus venosus. And ligamentum teres is nothing but the obliterated left umbilical vein. Ligamentum teres is nothing but the obliterated left umbilical vein. Okay, I'll start this for you. Have a look. This is extremely important MCQ, students. Tell me, what are the contents of umbilical cord? Yes, chalo, answer this, students. What are the contents of umbilical cord? This is another MCQ. Contents of umbilical cord. Boliye. There are two umbilical arteries and there is the left umbilical vein. Two umbilical arteries and two umbilical veins होते हैं, out of which one obliterates off. नहीं, contents of umbilical cord. Contents of umbilical cord would be two umbilical arteries and the left umbilical vein. Left umbilical vein. Two arteries and one vein. Which vein is that? Which vein is that? The left umbilical vein. Left. पहले दो arteries होती है, दो veins होते हैं. The right obliterates off. The right umbilical vein goes off and the left is left. Left is left. So just remember it like this. Two umbilical arteries and the left umbilical vein along with the Wharton's jelly. Wharton's jelly. This becomes the contents of the umbilical cord. Contents of umbilical cord. I'll start. Tell me, this left umbilical vein comes from where? कहाँ से आता है ये left umbilical vein? Can you answer this, students? Left umbilical vein comes from the placenta. Yes, it comes from the placenta. Very good. So what is it carrying? Pure blood. It is carrying pure blood. It is coming from the placenta, so it is carrying pure blood. So even if it's a vein, it is carrying pure blood. We have drawn this in red. So that is how I have drawn this in red. Okay? So the left umbilical vein carries pure blood and the left umbilical vein now brings this pure blood to, what is this vein? You know, this is the portal vein. That's a portal vein which is going to the liver, and the left umbilical vein would now go and join with the left branch of portal vein. It goes and joins with the left branch of portal vein. From the portal vein, the pure blood would go to the liver, है ना? From the portal vein, this is coming from the placenta, left umbilical vein, it will go to the left branch of portal vein. From the portal vein, it will go to the liver. The liver will use all this pure blood for its own metabolism. Liver ये सारा blood use कर लेगा. So the entire blood should not go to the liver, correct? The entire blood should not go to the liver. There is a bypass here. This is a big vein coming from the liver. ये कौन है? IVC. And there is a bypass from the left branch of portal vein to the IVC. Anyone? What is this? This is a bypass from the left branch of portal vein to the IVC, and this is what we call as the ductus venosus. Ductus venosus. So what is ductus venosus? Connect. Again, look students, what is the ductus venosus connect? You have to be very specific. It connects the left branch of portal vein to IVC. The left branch of portal vein to the IVC, that is connected by ductus venosus. From the IVC, the blood comes to the right atrium. From the right atrium, the blood goes to the left atrium. This is fetal circulation, I'm telling you students, fetal circulation. This is a very, very, very important MCQ. So from the right atrium, the blood directly goes to the left atrium through foramen ovale. Foramen ovale होता है ना in fetal life. That's a gap between the septum primum and septum secundum. वो जो gap होता है, that gap is known as foramen ovale. So from the right atrium, the blood directly goes to the left atrium through the foramen ovale, right? Because the lungs are not functioning, so the blood doesn't go to the ventricles. From the right atrium directly to the left atrium through the foramen ovale. From the left atrium, the blood goes to the left ventricle. From the left ventricle, it would go to the aorta. Aorta divides into two common iliacs. Common iliacs further divides into an external iliac and internal iliac. This is external iliac and internal iliac. And from this internal iliac, what begins are the two umbilical arteries. The umbilical arteries. So umbilical arteries are branches of what? Internal iliac artery. Remember this. Umbilical arteries are branches of internal iliac. अब ये internal iliac कहाँ होते हैं? Where are they located? In the pelvis. ये pelvis में. So the umbilical arteries will begin from the pelvis, from the internal iliac, and they're going up towards the umbilicus. Okay, they will be going up towards the umbilicus. And as they're going up towards the umbilicus, from the pelvis, they are going towards the umbilicus. बीच में आता है ये urinary bladder. On the way comes the urinary bladder. So if this is the urinary bladder, one artery will go from this side, one artery will go from this side. So both the umbilical arteries goes on either sides of the urinary bladder. I'll just make the bladder like this. It goes on either sides of the urinary bladder. Fine, students. Is this clear? Suppose from the right atrium, the blood goes to the right ventricle. Suppose if the blood goes to the right ventricle, by chance, right ventricle से the blood कहाँ जाएगा? In the pulmonary trunk. And from the pulmonary trunk, the blood would go to the lungs, right? From the pulmonary trunk, the blood would go to the lungs. But no, the lungs are not functioning, no. So the blood should not go to the lungs. Again, there is a bypass. है ना? Pulmonary trunk से aorta को एक bypass होता है, and this is what we call as the ductus arteriosus. This is ductus arteriosus, and this is the fetal circulation. This is fetal circulation. This is very important. ये देख लो, each and everything you have to know. This is the left umbilical vein. ये clear है बच्चों? If there's anything which is not clear, you tell me. And this is the umbilical artery. That's umbilical artery. Okay, my God, now this is gone. I'm so sorry. This is, इसमें क्या होता है ना? If I shift once again, the entire thing goes off. Okay, I'll just make it fast for you. So I'll make it in the same color now. These are the two umbilical arteries and the left umbilical vein. That's a liver, that's a portal vein. And the left umbilical vein goes and joins with the left branch of portal vein. From the left branch of portal vein, that's a ductus venosus which goes to the IVC. IVC से right atrium से the blood directly goes to the left atrium through the foramen ovale. Left atrium से left ventricle से aorta. Aorta divides into two common iliacs. Common iliac further divides into an external iliac and internal iliac, external iliac and internal iliac. And from the internal iliac, what are these? Umbilical arteries. जब ये umbilicus की तरफ जाते, they go on either sides of the bladder. From the right atrium, suppose the blood goes to the right ventricle. From the right ventricle, it goes to the pulmonary trunk, and from the pulmonary trunk, it would go back to the aorta through the ductus arteriosus. Okay, that page is gone, so I've drawn it again for you. So now you tell me, ये fetal circulation है students, what happens after birth? Tell me now. After birth, this goes off. Now this is the obliterated left umbilical vein. इसे क्या बोलते हो? Don't write this, I'll write this for you. Obliterated left umbilical vein after birth is known as ligamentum teres. Ligamentum teres, perfect. And this ligamentum teres is present in एक ऐसे sickle shaped fold of peritoneum होता है. A sickle shaped fold of peritoneum which begins from the anterior abdominal wall to the liver. Can anyone answer this? What is this fold of peritoneum? What is this fold of peritoneum? Which begins from the anterior abdominal wall, it goes to the liver, it spreads on the liver. What is this? Yes, very good. This is a falciform ligament. Very good, Aisha. That's a falciform ligament, and the lower border of falciform ligament में क्या होता है? Ligamentum teres. Okay, so the lower border of falciform ligament, you've got this ligamentum teres. So the obliterated left umbilical vein after birth becomes what? Ligamentum teres. Ductus venosus का क्या बनता है? Ligamentum venosum. Foramen ovale becomes what? The fossa ovalis. Fossa ovalis. Ductus arteriosus becomes the ligamentum arteriosum. Ligamentum arteriosum. And now this part of the umbilical artery is obliterated off. Dekho, this part is gone. This is the obliterated umbilical artery. And अब इसे हम बोलते हैं medial umbilical ligament. This is obliterated umbilical artery from the bladder to the umbilicus. ये obliterate होता है. The obliterated umbilical artery is now known as the medial umbilical ligament, and this becomes the non-obliterated part of umbilical artery. Now, where does it begin from? Internal iliac, and where does it go to? The bladder. It now supplies the bladder. It is now known as the superior vesical artery. अब ये बनेगा superior vesical artery. You understanding? So superior vesical artery is the non-obliterated part of umbilical artery. Non-obliterated part of umbilical artery, and the obliterated part becomes the medial umbilical ligament. Is this perfect? Should I write, or this is clear? Bolo bacho. If you want, I'll write. Otherwise, if this is clear, I'll then show you the slide. Next slide. Okay, tell me. Clear, no? No need to write, no? Fine, okay. Now, coming back to the MCQ. Look at this slide, students. Look at this slide. Tell me, ये क्या देख रहे हो? ये कहाँ से देख रहे हो? Where are you looking this from? And what is this that you're looking at? Come on, students. Especially for you. Chalo, answer this. This is a very important visual slide also. इसमें बहुत कुछ है which you should know. ये क्या देख रहे हो? What are you looking at? Come on, students, answer. क्या? Nirav, what is this? नहीं, this thing. What is this that you're looking at? ये क्या देख रहे हो? What is this structure that you're looking at? बोलो, students, come on fast. This is the anterior abdominal wall. Posterior नहीं है अंकिता. This is not posterior. Posterior abdominal wall पे क्या मिलता है? You get those three muscles. Psoas major, quadratus, transverse abdominis मिलेगा, aorta मिलेगा, IVC you'll get. That's the posterior abdominal wall. No, this is the anterior abdominal wall. Anterior abdominal wall. And where are you looking this from? You are inside the abdomen. You are inside the abdomen and आप सामने देख रहे हो. You're looking in front. From inside the abdomen, you're looking आगे की तरफ. You're looking in front. So this is the anterior abdominal wall. You're looking from inside the abdomen. अंदर से देख रहे हो. ठीक है? So now tell me, what is this fold of peritoneum? ये देखिए, what is this fold of peritoneum? Come on, students, answer. Be fast. What is this fold of peritoneum? This you should know. ये मैं बोल रहा था, this is a fold of peritoneum which begins from the anterior abdominal wall and goes to the liver. ये liver की तरफ जाएगा. This is the falciform ligament. यही है falciform ligament. And what is this? What is this in the falciform ligament? This is the ligamentum teres. ये है ligamentum teres. Clear? So ligamentum teres lies in falciform ligament. Perfect. Now, students, in fetal life, there's a communication from the bladder, from the apex of the bladder to the umbilicus. एक connection होता है. What is that connection known as? Can anyone answer this? In fetal life, from the apex of the bladder to the umbilicus, एक connection होता है midline में. What is that connection known as? I've told you this in the previous lectures. If you can recollect it. This one. This is a connection from the bladder to the umbilicus. Yes, what is this? Urachus. Very good. This is known as urachus, or this is what we call as the allantois. ये allantois होता है या urachus. This extends from the bladder to the umbilicus. Okay, this is in fetal life. Once after birth, this connection obliterates off. This urachus is obliterated. अब ये क्या बनेगा? The median umbilical ligament. So what is median umbilical ligament? That is the obliterated urachus or allantois. And if this does not obliterate, the child will be passing urine through the umbilicus. क्या बोलते हो? What do you call this as? Weeping umbilicus or crying umbilicus. What is this? What is this? This is the medial umbilical ligament. And this medial umbilical ligament is the obliterated umbilical artery, जो अभी हमने ड्रॉ किया था ना fetal circulation में. That obliterated umbilical artery, यही है वो medial umbilical ligament. Is this clear to all of you? Following this? Okay. So this is what you are supposed to know. A very important slide. If anyone can tell me what is this artery here? ये क्या artery है? This is an artery. This one. This is an artery which is entering into the abdomen from the thorax. From the thorax, this artery is coming in the abdomen. This is the superior epigastric artery, and this superior epigastric artery will anastomose with inferior epigastric artery. यह है inferior epigastric artery, and ऊपर से आता है superior epigastric. So superior epigastric artery is going to anastomose with inferior epigastric artery. Okay, students, एक मिनट, let me see. This is done. This is done. ये सब clear है? Okay, चल answer this. Medial boundary of anatomical snuff box is formed by. Anyone? Medial boundary of the anatomical snuff box is formed by. Come on, students. Answer this. You can crack this MCQ. Come on, answer. Yes, very good, very good. Very good, Aisha. That's the extensor pollicis longus. Extensor pollicis longus. Extensor pollicis longus is going to form the lateral boundary, the medial boundary of the anatomical snuff box. Medial boundary. Extensor pollicis longus. अब ये कैसे याद रखोगे? You get plenty of MCQs on anatomical snuff box. Anatomical snuff box पे बहुत MCQs आते हैं. Just remember the slide which I'm drawing for you, students. Look, this is so easy. That's the head of the radius. That's the neck of the radius. What is this for the radius? ये होता है radial tuberosity. And can you tell me what is inserted on the radial tuberosity? Come on, students. Insertion on the radial tuberosity. कौन सा muscle होता है on the radial tuberosity? That's a biceps brachii. Biceps brachii. And okay, this is the radius and ulna from the dorsal aspect. पीछे से आप देख रहे हो radius and ulna from the dorsal aspect. Okay. Now students, tell me. There's a muscle which begins from both radius and ulna. There's a muscle which begins from both radius and ulna. What is this muscle? Abductor pollicis longus. Abductor pollicis longus. There's a muscle which begins from the radius alone, extensor pollicis brevis. Okay, so abductor pollicis longus and the extensor pollicis brevis, they go together. ये ऐसे साथ में जाते, they go together. So they are towards the radius. So ये क्या boundary होगा? What is this boundary going to be? This is going to be the lateral boundary of the snuff box, and this is a muscle which begins from the ulna, extensor pollicis longus. And what boundary is this going to form? This is going to form the medial boundary of the snuff box. Clear? So lateral boundary of the anatomical snuff box would be formed by abductor pollicis longus and extensor pollicis brevis. The medial boundary would be formed by extensor pollicis longus. The floor of the snuff box would be formed by the styloid process, the scaphoid and the trapezium. Styloid process, scaphoid and trapezium bones. Okay, styloid process, scaphoid and trapezium, and this bone undergoes avascular necrosis. If there's a fracture, no, avascular necrosis होता है ना scaphoid का. So who lies in the floor of the snuff box? The styloid process of radius, the scaphoid and the trapezium. Tell me, what are the contents of the snuff box? Students, contents क्या होते हैं? Who lies in the snuff box? Anyone? If you can answer this, who's lying within the snuff box? In the snuff box lies the radial artery. Radial artery is the content of the snuff box. Content. Understand this. And who lies in the roof of the snuff box? In the roof lies the cephalic vein and the superficial branch of radial nerve. Cephalic vein and the superficial branch of radial nerve. Clear, students? So that's about the snuff box. Just remember the slide, it's very easy. So laterally abductor pollicis longus, extensor pollicis brevis. Medially क्या होगा? Extensor pollicis longus. Floor में क्या होगा? Styloid process, scaphoid and trapezium. Content क्या है? Radial artery. And who's in the roof? The cephalic vein and the superficial branch of radial nerve. I hope this is clear to all of you. इसमें ना हमेशा मिस्टेक करते हैं स्टूडेंट्स. Content is radial artery. Remember, cephalic vein content नहीं है. Content of the snuff box, radial artery. Okay, and cephalic vein is where? In the roof with the radial nerve. Superficial branch of radial nerve. Fine. Okay, we go to the next MCQ. Correct. Look at this slide. If you can understand this slide, I'll just magnify bachcho for you. Yo. Look at this. So, what are these two muscles? Look at this. This is the abductor pollicis longus and that's the extensor pollicis brevis. है ना? So, abductor pollicis longus and extensor pollicis brevis, they are going to form the lateral boundary. ये lateral boundary होगा. What is this muscle? This is the extensor pollicis longus. That's the medial boundary of the snuff box. Styloid process, scaphoid and trapezium हो गए फ्लोर में. हाँ, तो ये ऐसे विजुअल्स आते हैं. You get visuals on this. So arrows will be pointed and you'll be asked MCQs on this. So you just remember this. Okay, students, coming to the next MCQ. Come on, if you can answer this. Obturator nerve supplies one of the following muscles. Answer this. Very good, very good. Answer is C. Adductor brevis. Obturator nerve supplies the adductor brevis. Correct. Tell me, who supplies the sartorius? Answer this. Students, who supplies the sartorius? Boogie. Sartorius is a muscle in the anterior compartment of the thigh. Anterior compartment of the thigh. Nerve supply of sartorius is femoral nerve. Femoral nerve. Very good. Who supplies the obturator internus? Answer this. Obturator internus. Anyone? Obturator internus is supplied by. Come on, students. Guess. Nerve to obturator internus. Very good. That nerve to obturator internus also supplies the superior gemellus. Superior gemellus. So the nerve to obturator internus supplies the superior gemellus and the obturator internus. Okay. Gluteus medius. Who supplies? Gluteus medius. Yes, students, answer. Gluteus medius can nerve supply. Very important. Superior gluteal nerve. Very good. So the superior gluteal nerve supplies three muscles. Superior gluteal nerve supplies the gluteus medius, gluteus minimus, and the tensor fascia lata. Tensor fascia lata. So superior gluteal nerve 3 muscles supply करता है. You remember this: gluteus medius, gluteus minimus, and the tensor fascia lata. Tensor fascia lata. Okay. Gluteus medius, minimus, and the tensor fascia lata. Now you tell me, students, what is this here? Understand this, and this is another very important MCQ. ये देखिए, see if you can understand this. Yep, I'll start like this. Tell me, obturator nerve is a branch of what plexus? What is this plexus? Come on, students. What is this plexus? Chalo, bolo fast. This is a visual slide for you. What is this plexus? That's the lumbar plexus. So obturator nerve is a branch of which plexus? Lumbar plexus. Obturator nerve is related to this part of the sacrum. What do you call this part of the sacrum as? Can anyone answer this? ये क्या बोलते हो? What is this known as? ये है sacral promontory. ये है sacral promontory, and what is this for the sacrum? Ala of the sacrum. Very important, students. Very important. Relations of the ala of sacrum. ये मैं बोलता हूँ आपको. Relations of the ala, I'll tell you. Now, obturator nerve पीछे है. Sacrum is backside. बराबर. Sacrum is behind. Obturator nerve is behind. And what is the exit for obturator nerve? The exit for obturator nerve आगे है. That's the obturator foramen. Obturator foramen is in front. Obturator nerve पीछे. How does the obturator nerve go towards the obturator foramen? It doesn't go through and through. It doesn't go straight. No, because there are the ligaments of the uterus, of the bladder. So it cannot cross the ligaments. So the obturator nerve goes along the walls of the pelvis. Look. The obturator nerve winds around the walls of the pelvis, and जब ये ऐसे जाता है, when it goes along the walls of the pelvis, there's an organ here to which it is related to. Can anyone answer this? What is this organ to which the obturator nerve is related to? What is that structure here? That's the ovary. So obturator nerve would be related to the ovary here. यहाँ पे एक fossa होता है जिसका नाम है ovarian fossa, and the obturator nerve is going to form the lateral boundary of the ovarian fossa. These are very important points, students. I'll write this for you. It forms the lateral boundary of the ovarian fossa. The obturator nerve now gets out through the obturator foramen and divides into 2 divisions. ये 2 divisions में divide होता है. If you can tell me, what is this muscle which is cut here? ये कौन सा muscle है? Come on, answer, students. What is this muscle which is cut here? This is the adductor longus. Adductor longus है ये. The muscle which is cut here is adductor longus. What is this muscle? Adductor brevis. So obturator nerve divides into an anterior and posterior division. The anterior division, if this comes as a visual, students, and if this is pointed to you, what is this division? The anterior division of obturator nerve lies between what and what? It lies between the adductor longus and the adductor brevis. ये है anterior division, and the posterior division lies between the adductor brevis and the adductor magnus. Adductor brevis and magnus. That's the posterior division of obturator nerve. Okay, and then now you have to know what is the anterior division supply and what is the posterior division supply. Okay, we'll come to this. This is very important, students. I'll just write this for you. Chalo. Obturator nerve. It's a branch of lumbar plexus. Yeah, each and every point is an MCQ. Branch of lumbar plexus. What is the root value? कोई बोल सकता है, what is the root value of obturator nerve? It is formed by the ventral divisions of ventral rami. Ventral divisions of ventral rami of L2, L3, L4. Just remember it like this. Ventral divisions of ventral rami. Okay. Dorsal divisions of ventral rami से क्या बनता है? Dorsal divisions of ventral rami forms femoral nerve. L2, 3, 4. Dorsal divisions of ventral rami of L2, 3, 4 is femoral. Ventral divisions of ventral rami of L2, 3, 4 is obturator nerve. Related to ala of the sacrum. Related to ala of the sacrum. Forms, ये सब MCQs है, सब points MCQs है. Forms the lateral boundary of ovarian fossa. Forms the lateral boundary of ovarian fossa emerges out through obturator foramen. ये emerges है, this is emerges out through the obturator foramen. Now divides into anterior division and posterior division. Just remember the way I'm telling you. It divides into an anterior and posterior division. Anterior division lies between adductor longus and adductor brevis. Lies between the adductor longus and adductor brevis. Posterior division lies between the adductor brevis and adductor magnus. Okay. So anterior division lies between the longus and the brevis. The posterior division lies between the brevis and the magnus. What does the anterior division supply? It supplies the adductor longus, adductor brevis, adductor longus, adductor brevis, gracialis, and the medial half of pectineus. Medial half of pectineus. Clear? So it supplies the adductor longus, adductor brevis, the gracialis, and the medial half of pectineus. Medial half of pectineus. The posterior division lies between adductor brevis and adductor magnus. It supplies the adductor magnus and the obturator externus. Obturator externus. Just be very clear about this. Every point that I have written is an MCQ for you students. Every point. Okay, so it's a branch of lumbar plexus, ventral division of ventral rami, related to the ala of the sacrum, forms the lateral boundary of ovarian fossa, gets out through the obturator foramen, divides into an anterior and posterior. Anterior division lies between longus and brevis, posterior between the brevis and magnus. अब anterior क्या supply, posterior क्या supply करता है. This is what you have to know. Is this clear? Okay, I hope everything is clear to you. अब ये जितने भी muscles हैं, all the muscles in the medial compartment of the thigh, they do what? All the muscles in the medial compartment of the thigh, they are going to do this action. What is this? Adduction. And they are going to do this. They turn the thigh inwards. क्या बोलते हो? They do medial rotation. So all the muscles in the medial compartment are going to do adduction and medial rotation. But students, एक exception है. There's only one exception. This muscle. ये कौन है? Identify this muscle. Students, if you can identify this muscle. This is a visual for you. Yes, a visual slide है students. What is this muscle? Come on. Can anyone answer this? Very good, very good. That's the obturator externus है ये students. This is obturator externus, no? ये है obturator externus. Why? Because it is beginning from the obturator foramen here and it is going back into the trochanteric fossa. That's the obturator externus. बस ये एक exception है. This muscle when it contracts, it turns the femur outwards. What is that? Lateral rotation. So what is the action of obturator externus? Lateral rotation. ये याद रखना. A very important MCQ. I'm telling you this are important MCQ students. You should know this. So all the muscles in the medial compartment, they do adduction, they do medial rotation. बस एक muscle है obturator externus. This does lateral rotation. That's the only exception. Lateral rotation. Clear? I hope this is clear. Just quickly tell me what are the relations of the ala of sacrum. A very important MCQ. Relations of ala of sacrum. Relations of ala of sacrum. A mnemonic to remember for you. Normally I don't tell mnemonics, but this is easy. Slio. This sequence होगा medial से lateral की तरफ. Medial to lateral, that's slio. What is S? S is sympathetic trunk. Sympathetic chain you can write. Sympathetic chain. L is the lumbosacral trunk. Lumbosacral trunk. This is sympathetic chain. Lumbosacral trunk is formed from L4, L5. L4 and L5. That's lumbosacral trunk. What's I? I is the iliolumbar artery, iliolumbar artery. O is the obturator nerve. So S is sympathetic chain, L is the lumbosacral trunk, I is the iliolumbar artery, and O is the obturator nerve. Be very clear. Relations of the iliac sacrum. ये iliolumbar artery सुना है कहीं? Have you heard this iliolumbar artery somewhere? I've told you this yesterday only. I've told you. If you can correlate, students, what is this iliolumbar artery supply? Iliolumbar artery is a branch of what? It's a branch of posterior division of internal iliac. ये जो iliolumbar artery है ना, it's a branch of posterior division of internal iliac, and this iliolumbar artery is going to supply the L5 vertebrae. L5. It is going to supply the L5 vertebrae. अब ये artery कहाँ है? It's in the pelvis. Internal iliac, it's in the pelvis. So internal iliac का ये branch है. So this has to be in the pelvis. Clear? Now this iliolumbar artery ascends up, and as it is going up, it is related to ala of the sacrum. ठीक है? Now it goes and supplies the L5 vertebrae. Perfect है. Aorta was supplying how many lumbar vertebrae? 4. Aorta L4 पे divide होता है. Aorta supplies only 4 lumbar vertebrae. L5 बाकी था, and this L5 is supplied by iliolumbar artery. I hope this is clear to all of you students. Okay. And something very similar. एक minute, I'll tell you something here. Relations of the neck of the first rib. Something very similar. Relations of the neck of the first rib. This is SVAN. Swan, from medial to lateral. Something very similar. Same है ये. जैसे SLIO था ना, SLIO was the relation of the iliac sacrum. वैसे SVAN is the relation of the neck of the first rib. What is S? S is the sympathetic chain. This is a very important MCQ. V is the first posterior intercostal vein. A is the superior intercostal artery, and N is the first thoracic nerve. S is the sympathetic chain. Relations of the neck of the first rib. Students, today I have told you many important things. Just remember all these things and revise this again and again. Relations of the neck of the first rib. SVAN, medial to lateral. S, sympathetic chain. V is the first posterior intercostal vein. A is the superior intercostal artery, and N is the first thoracic nerve. Okay? Fine. Chalo, we'll go to the next MCQ. Answer this, students. Come on. Nucleus ambiguous is made up of dash cranial nerves. बोल सकते हो? Nucleus ambiguous is made up of dash cranial nerves. What is this nucleus ambiguous? It is made up of 3 cranial nerves. कौन से ये 3? Which are those 3 cranial nerves? Come on, students, you can crack this MCQ. Huh? 9th, 10th and 11th. Yes, that's motor. 9th, 10th and cranial accessory. That's nucleus ambiguous. Very good, Aisha. That's 9th, 10th and 11th. That's cranial accessory nerve. Cranial accessory. Ek minute, I'll just enumerate this for you. Tell me, what is the name of the component which is going to supply the muscles of the pharyngeal arches? That's a special visceral efferent component. And which are the nerves of the pharyngeal arches? Nerve of the first pharyngeal arch is mandibular nerve. Nerve of the second pharyngeal arch is facial nerve. Nerve of the third pharyngeal arch is glossopharyngeal nerve. Nerve of the fourth pharyngeal arch is superior laryngeal. And nerve of the sixth pharyngeal arch is recurrent laryngeal nerve. Recurrent laryngeal nerve. Okay. So now the first pharyngeal arch is mandibular nerve. Supplies the muscles of first pharyngeal arch. What is the name of the nucleus of the trigeminal nerve which supplies the muscles of first pharyngeal arch? समझ में आ रही है students? There will be a special nucleus. What is the name of the nucleus of trigeminal nerve which supplies the muscles of the first pharyngeal arch? The name of the nucleus is motor nucleus of trigeminal nerve. Motor nucleus of trigeminal nerve. ये nerves है, ये nucleus है, arches है. This is something that you have to know. I'm writing the nerves, I'm writing the nucleus. Component special viscerally friend. Component is special viscerally friend. ये arches लिखा first, second, third, fourth and sixth arches. Nerves of the arches and इनके nucleus लिख रहा हूँ मैं. So motor nucleus of trigeminal nerve. What is the name of the nucleus of facial nerve? That's the motor nucleus of facial nerve. And for the 9th, 10th and there's a cranial accessory also. That's nucleus ambiguous. Nucleus ambiguous. So nucleus ambiguous is going to supply the muscles of which pharyngeal arch? The 4th and the 6th. The 3rd, 4th and 6th. 3rd arch, 4th arch and 6th arch. So nucleus ambiguous is a common nucleus for the glossopharyngeal nerve, the vagus nerve and एक nerve होती है which goes with the vagals, the cranial accessory. The cranial accessory. Tell me, ऐसी एक similar nucleus है which three nerves relay in that nucleus. But it's an afferent nucleus. Which is that nucleus? Are you following this? Are you following what I'm saying? Yes, are you following what I'm saying? Students? Look, एक मिनट, I'll just make this for you. जैसे ये, one moment, I have to come back to the screen. Look, जैसे है ना, ये motor nucleus है, motor, and this is sensory. The motor nucleus is nucleus ambiguous. Nucleus ambiguous, and it is made up of 9th, 10th and cranial accessory nerve. Similarly, you've got a sensory nucleus. That's a nucleus of tractus solitarius, and it is made up of how many nerves? Which are the three nerves which relay in the nucleus of tractus solitarius? This is what I'm asking. Which are the three nerves which relays in the nucleus of tractus solitarius? Yes. I'm just trying to correlate this. Yes, 7, 9 and 10. 7, 9 and 10. Yes, very good. It's coming from the tongue, no? Tongue. Special sensations tongue से लेके आते हैं. Anterior 2/3, 7th nerve. Posterior 1/3, 9th nerve. And posterior most part, 10th nerve. 7th, 9th and 10th. So देखो, nucleus ambiguous and nucleus of tractus solitarius similar है. Only one is motor, one is sensory. Motor is nucleus ambiguous. Which cranial nerves are this? 9th, 10th and cranial accessory. And sensory is nucleus of tractus solitarius. Which cranial nerves are this? 7, 9 and 10. 7, 9 and 10. I hope this is clear to you. Come on, we'll come to the next slide. Students, come on, identify this pointed structure. Identify this pointed structure. Yes, that's a musculocutaneous nerve. Yes, what about the others? Answer this. This is the musculocutaneous nerve. अगर ये musculocutaneous nerve है, what is this muscle which is reflected? ऐसे reflect here. What is that muscle? What is that muscle which is reflected? Are you following, students? What is this muscle which is reflected here? ये muscle. Answer this. A very important visual slide. इसको magnify करूँ. I'll magnify this. Okay, अभी बोलो. चलो अभी बोलो स्टूडेंट्स, what is this muscle which is reflected? Yes, I reflect here to see this structure. What is this? Come on students. Pectoralis minor. Very good. That's pectoralis minor. So which part of axillary artery is this which the pectoralis minor is going to cover? ये कौन सा part होगा axillary artery का? Second part. ये होगा second part of axillary artery. What is this? Musculocutaneous nerve. What is this muscle? This is the pectoralis major. सबसे बाहर है ये. That's a pectoralis major. हाँ, सबसे बाहर. Pectoralis major को reflect किया. Then we have reflected the pectoralis minor, and here would be the subclavius. So we have reflected the anterior wall of axilla. And now what are we seeing? We are seeing the contents of the axilla. Which cord is this? Lateral cord. So what is this nerve? That's the musculocutaneous nerve. What is this? Anyone can identify this nerve? What is this nerve? Students, answer this. What is this nerve? That's a lateral root of medial nerve. Lateral root of medial nerve. This is the medial root of medial nerve. And what is this? Medial nerve. That's the lateral root of medial nerve. Medial root of medial nerve. And that is the median nerve. Medial nerve. Okay. So that's the medial nerve. Okay, that's about the slide. This is the axillary vein. That's the axillary vein. Fine. We'll go to the next MCQ. Chalo students, answer this. Anterior inferior cerebellar artery is a branch of. Come on, the last MCQ of the day, a very important topic. Anterior inferior cerebellar artery is a branch of. Can anyone answer this? Anterior inferior cerebellar artery is a branch of basilar artery. Very good. It's a branch of basilar artery. Very nice. It's a branch of basilar artery. Basilar artery. Now coming to the arteries, if you can quickly answer this, I'll make it very easy for you students to understand this topic. Tell me, what are the branches of vertebral artery? Vertebral artery के branches बोलो. This is a very important MCQs. One, vertebral artery के branches बोल सकते हो? The first branch. There are two vertebral arteries. This gives half a branch, and this is a single artery which runs in the midline. What is that? Anterior spinal artery. Second, posterior spinal artery, and third, that's a posterior inferior cerebellar artery. Remember this, branches of vertebral: anterior spinal, posterior spinal, and the posterior inferior cerebellar. Branches of basilar artery. Basilar artery के branches: one, pontine branches, labyrinthine artery. Third, anterior inferior cerebellar artery. Anterior inferior cerebellar. Fourth, superior cerebellar. And the last one is posterior cerebral artery. Okay. So what are the branches of basilar artery? The pontine branches, it gives branches to the pons. These are known as pontine branches. Next is labyrinthine artery. Labyrinthine artery goes to the internal acoustic meatus. The anterior inferior cerebellar, the superior cerebellar artery. ये superior cerebellar है, and the last one is posterior cerebral artery. Posterior cerebral. आप कैसे याद रखते हो? This is the midbrain, that's a pons, and that's a medulla. And what's this going to be? What is this going to be? The cerebellum. See, this is the easiest way to understand the arteries if you are not able to recollect like this. So midbrain, pons and medulla, that's the cerebellum. अब कैसे याद करोगे? You divide the cerebellum into two halves. Cerebellum को दो half में divide किया. What is this surface? Superior. What is this surface? Inferior. The inferior surface we divide into two halves. What is this? Anterior inferior. This is posterior inferior. ठीक है? So cerebellum को दो हाफ में डिवाइड किया. We divide the cerebellum into two half, the superior surface, inferior surface. Inferior surface को दो हाफ में डिवाइड किया, anterior inferior and posterior inferior. Anterior inferior, posterior inferior. ठीक है. Now understand how the arteries are named. What are these two arteries? Vertebrals. Two vertebrals joins to form what? Basilar artery. Two vertebrals joins to form the basilar. What are the branches of vertebral? A single artery. ये half branch देता है, half branch देता है. And what is this? A single artery which runs in the midline, anterior spinal. What are these arteries which are given on the posterior side? What's that? Posterior spinal artery. And the third artery is going to supply the medulla and the cerebellum. What's that? Posterior inferior cerebellar artery. Posterior inferior cerebellar artery. Anterior spinal, posterior spinal and the posterior inferior cerebellar artery. Yeah, ऐसे याद रखना. These are the branches of vertebral. Clear to all of you? Anterior spinal, posterior spinal and pica. What are the branches of basilar artery? The basilar artery gives branches to the pons. बहुत सारे branches होते हैं ये by the name of pontine arteries. Pontine arteries. An artery which goes to the internal acoustic meatus, that's the labyrinthine artery. An artery which goes to the internal acoustic meatus, that's labyrinthine. Then an artery which is going to supply this. What is this? This is the anterior inferior cerebellar artery. Anterior inferior cerebellar artery. Then what is this artery going to be? This is the superior cerebellar artery. Superior cerebellar. And two terminal branches by the name of posterior cerebral arteries. Posterior cerebral arteries. Just remember it like this. ऐसे याद रखना. इस पर बहुत MCQs आते हैं. ठीक है? So what are the branches of basilar? These are the pontine branches. This is the labyrinthine artery. That's an anterior inferior cerebellar, superior cerebellar and two posterior cerebral arteries. So this becomes the branches of basilar artery. I hope this is clear to all of you. Tell me, thrombosis of this pontine branches. ये जो pontine branches है ना, इनका thrombosis of this pontine branches gives rise to what? What does it give rise to? एक syndrome बनता है. What is that syndrome known as? If anyone can answer this. Thrombosis of this pontine branches leads to a syndrome. If you can answer that, that's okay. Otherwise, we'll see it later. I'll clear this. I'll clear this. Okay. ये बोलो, ये easy है. Thrombosis of pica, posterior inferior cerebellar artery leads to, anyone? Thrombosis of pica leads to lateral medullary syndrome. Lateral medullary syndrome, it is also known as Wallenberg's syndrome. Wallenberg syndrome. Lateral medullary syndrome or Wallenberg syndrome. Okay. Thrombosis of pica, posterior inferior cerebellar artery leads to Wallenberg syndrome or the lateral medullary syndrome. Lateral medullary syndrome. Okay, students. Just one last MCQ left for you, but before I come to the last MCQ, let me brief you about our platform, some new courses coming here. So we've got a plus subscription in which there are daily live classes, live quizzes, learning from the top educator, access from the device of your choice. And students, you can now access the question bank too with 25,000 plus MCQs. An iconic subscription where that's the best of Unacademy and pre-platter. Some special class features in which that is interactive live class, poll for the learners, yes, raise a hand technique, never miss a class with proper notifications been given, right? And suppose if you miss a class, you get this recorded lectures, you get this PDF files, and anytime, anywhere you can access the class and get your doubts solved. A highly effective and updated question bank with latest MCQ and detailed explanatory answers has been prepared for you. Okay. These are our NEET PG toppers, the last NEET PG which was conducted. We congratulate once again to all of them. And students, this is the NEET PG Compact. Just spread this message to your friends too. The biggest scholarship that Unacademy is giving, a huge number of benefits, scholarships, Amazon vouchers. You can get a free subscription too. So the date is 28th of November, the time is 5 p.m. So enroll now, and it's a free test. So crack this, okay? November 28th, 5 p.m. So these are the rank 1, rank 2, rank 11 to 50, rank 51 to. So these are the scholarships that you're going to get. Just have a look. Raise a hand technique, and if you press the icon, you directly talk to the educator. And students, look at this. Look at this. This is something very important. We've got a ritual. That means the same time on the same day of the week we conduct a program. Like on Wednesday 9 p.m. it's an educator curated test. मतलब ये subject wise होगा. This will be a subject wise test prepared by the educators. On Friday 9 p.m. study with me, the YouTube series. On Saturday 9 p.m. special class marathon based test series. And Sunday 10 a.m. you've got this grand test for NEET PG, for INI-CET, and for the PG NEET. Okay, and for the FMGE. So these are the. Now we're starting with 2 new batches: Focus FMG 2022 and Target NEET PG 2022 batch from 24th of November. Download the Unacademy app and subscribe to it. Okay, coming to the last MCQ. Answer this. While considering the femoral sheath and canal, which of the following statement below is incorrect? Come on students, answer. Yes, very good. Very good, Aisha. Very good. The sheath contains femoral nerve. That's wrong. So femoral nerve is outside the femoral sheath. And a femoral nerve, femoral sheath में नहीं होता. Now femoral sheath has got 2 walls. One is the anterior wall, one is the posterior wall. Can you tell me the anterior wall of femoral sheath is formed by what? Anyone? Anterior wall of femoral sheath is formed by, that's formed by fascia transversalis. Anterior wall is formed by fascia transversalis. No, anterior wall is fascia transversalis. Posterior wall is formed by the fascia iliaca. Posterior wall is formed by the fascia iliaca. This femoral sheath has got 3 compartments. ऐसे 3 compartments होंगे femoral sheath के. One is the lateral, one is intermediate, and one is the medial compartment. Who lies in the lateral compartment? The femoral artery plus the nerve. What's that? The femoral branch of genitofemoral nerve. Femoral nerve नहीं होता है. It's the femoral branch of genitofemoral. So who lies in the lateral compartment? That's the femoral artery and the femoral branch of genitofemoral nerve. Intermediate is the femoral vein and the medial compartment is known as the femoral canal. ये empty होता है. That's the femoral canal. The upper part of femoral canal is known as, इसे क्या बोलते हो? What is this upper part of femoral canal? Known as femoral ring. Femoral ring. And this femoral ring is closed by a lymph node. What is this? The femoral ring is closed by a lymph node. That is the lymph node of Cloquet or Rosenmuller. Lymph node of Cloquet or Rosenmuller. And what does it drain? It drains the glans penis or the glans clitoris. It drains the glans penis or the glans clitoris. That's a lymph node of Cloquet or Rosenmuller. And student, one last thing. This femoral ring is wider in whom? The femoral ring is wider in females. Why? Because the pelvis is wider and the femoral vessels are small in size. Femoral vessels छोटे हैं. So femoral ring becomes wider in females. So chances of femoral hernia are very common in females. Very common in females. Right? So this is everything that I have told you. Now just tell me, what are the boundaries of femoral ring? The anterior wall of femoral ring. This anterior wall is formed by what? Anterior wall is formed by the inguinal ligament. The femoral ring ke boundaries quickly I am telling you. Anteriorly is the inguinal ligament. Medially is the lacunar ligament. Lacunar ligament. Posteriorly is the pectinate ligament. Pectinate ligament. And laterally is the septum separating it from femoral vein. Septum separating it from the femoral vein. So that becomes the femoral ring. So clear students, what are the boundaries of femoral ring? Anteriorly is the inguinal ligament. Inguinal ligament का दूसरा नाम है Poupard's ligament. Poupard's ligament. Remember this alternate names also. This is also known as Pouparts. Poupard's ligament. Medially is the lacunar ligament. Lacunar ligament is also known as the Gimbernates. Gimbernates ligament. Posteriorly is the pectinate ligament, also known as the Cooper's ligament. And laterally is the septum separating it from femoral vein. Laterally is the septum separating it from the femoral vein. I hope you've understood everything, students. Are you all happy? Have you understood everything? Whatever I've told you today is very important, huh? Everything, every point that I've talked about today is an MCQ. This is very important. Okay, fine, clear to all of you. So, see you next time. Whenever there's a lecture, you'll get a notification. Thank you for all this. Thank you. It was a very good session and you were very interactive. So it was a very nice session for me to conduct. Okay, thank you. So see you. So see the diagrams and all that we have drawn. Just go through those diagrams and try to draw this line diagram. So the moment you draw a diagram, that means your concepts are clear. And try to see many more visuals. The more visuals you see, the more your concept gets clear. Okay. So thank you to all of you once again and see you later. Thank you.